Okay, hi there, it's Dr. Buford. We're just getting started on the right knee. We're looking in the medial compartment right now. So this is the anterior horn of the medial meniscus. You can see my shaver just sitting right on top of it. This is the meniscocapsular junction here. That looks good. This is the femoral condyle up above and the tibial plateau down below. And so far, so good. These structures look great. We're going to look in the notch here. In this structure, let me rotate the camera a little bit. This structure is your anterior cruciate ligament. I'm just going to run the shaver just because it gives us a little bit of suction. But this is your ACL. And as we look at your ACL, it looks good. Your knee was stable under anesthesia. And then here we can see how the ACL comes off the tibial plateau here, comes off the eminence and goes up here back to the femur. And that's a good, healthy looking ACL. And so now we're going to try and look in the posterior compartment on the medial side and see if we can get a look at this medial meniscus here. Probe. Okay, so this is the root of the medial meniscus here. And the good news here is that it looks good, at least at first glance. I'm going to see if I can get a probe back here and show you what I'm looking at. I'm looking right down here. Okay, see that? That's the posterior root of the medial meniscus. And as we get back here and probe it, and tug on it, it is checking out to be pretty stable. So there's a good look at how we can push on it. I've had a couple really sensitive MRI scans in the past week or two where there was a suggestion of a root tear. But that part right there, that looks pretty good. Now, from here we're going to work backwards more into the posterior horn and look at that in just a minute. But I just wanted to show you the root. I don't think there's a benefit of, or that you need a root repair at this point. But we still need to look at the meniscocapsular junction in a little bit different part of the meniscus, okay? But I think that's a pretty good demonstration of what's going on. As we tug up, that root looks pretty solidly attached. So we'll show you some more in just a minute. Okay, so now we're looking more at the posterior horn. The root is going to be back, if you follow the probe, the root's back here to the left. And now we're into more the posterior horn. I'm going to try and turn up the brightness. Okay, we're just turning up the brightness. I'm working on our picture for a minute. But I just wanted to show you that we're still on the medial side of the knee. We don't have one that's just a gravity, do we? Actually, this will go just, will it if the pump's not on? Shaver's not on, rather? Okay, so here's the meniscus coming around. I've probed it a bunch as we're sitting here waiting for the picture to clear up a little bit, and it actually is checking out pretty good. Right now we're just putting another cannula in for you. Okay. Okay, so I think that's looking okay there. Can't really probe that anymore. And so now here's the central part of the knee, and that's the ACL that we've already talked about. We're going to sneak over and look in the lateral compartment here. Let's see. Make sure there's nothing over here. Remember, this is where you were sore also. So here's anterior horn. And in just a minute, we'll go ahead and take the lateral post out. Table down, please. You can just pull it out. Okay, let's go to the figure 4 position here. Bend your ankle up. That's good. Okay, and so we're just going to reposition your leg here, and that'll open up this compartment so we can see a little bit better. So as we look here, here's the posterior horn. Of that lateral meniscus, that looks pretty good. As we come around, we can see the body. If we push down, we can see the popliteus tendon back here. Running up towards about 11 or 12 o'clock on the screen. That looks good. Right back there, that's popliteus right there. And there's just some minimal fraying on the meniscal edge here. See that? Not really seeing much. You have a straight biter, just so I can investigate that. And then here you can see some undersurface changes, but again, some of these are almost microscopic in nature. We put this in. Push down on the knee. You can see we're just trying to make sure we're back to a stable margin here. That looks pretty good. I sure don't think you need any aggressive meniscectomy or anything like that. Show you some more in a little bit. Okay, so this is the patellofemoral joint. It's patella at the top of the screen. The groove that the patella glides in. Hold this shaver just for a second. It's called the trochlea. And as we look at that, it looks fine all the way down to the front of the knee. Okay, that's the ACL tucking back up underneath there. And so as we look here, here's the lateral gutter. That looks good. If you can turn off that, whatever that was. And we can look down the medial gutter here as well. No loose pieces. So I don't see anything else really to worry about. So that's really good news here. And what I'm going to do is just take one more look around this kind of anterolateral region because you're a little sore over here, but I don't see anything else to worry about. We've debrided a bit of the meniscus. I don't see any other scar tissue, so we'll get our PRP injection done and get you back to the recovery room shortly. Hopefully that'll do the trick for you, okay? Bye-bye now.